People who work in hospital, what is the worst thing you have seen a patient go through? I was in my second clinical rotation as a nursing student. We were assigned patients and the patient I was assigned to was a grumpy old guy who was 79. He had a good sense of humor but you had to tread carefully around him. He had chronic pain and was diagnosed with colon cancer. His son would visit in the mornings just in time to talk to the doctors doing their morning rounds. His wife had passed a few years earlier. I was helping him get ready for breakfast when the doctor walked in. This was pretty typical, but he was anxious to see the doctor today as he just had a bunch of tests done and was hoping to hear some results so he could be discharged to go home. I usually just finish up whatever I am doing and leave so that the patient and doctor can talk privately. That morning his son was not able to make it in and my patient asked if I could stay in the room with him to hear everything, in case he missed something. I said sure, no problem, as long as the doctor is okay with it as well. Some doctors don't like dealing with students. The doctor just got right to the point. The cancer had spread and there was nothing more they could do. The palliative team would be coming to meet with him this afternoon to discuss where he could be transferred to during his final days. My patient thought the doctor was joking and started to laugh and then just sat there with a completely blank look. As a student I was not prepared to know how to comfort someone in that situation, as it was something I didn't have experience with. I felt awful because 10 minutes before he got this news he was telling me he couldn't wait to see his cat once he got home. For the next week he did not get out of bed, refused to eat and take medication or shower. And then I came in one day and he was transferred out. Hearing the news that their newly transplanted heart is being rejected by their body. Early stages are treatable and the protocol for testing is there for a reason, but even knowing all of that, it's scary as shit to be given another chance at life and then have it all be hanging in the balance again so soon. This isn't for me but my mother. She is an ER surgeon. This little girl, probably 6 or 7 years old, had some form of spinal cancer. My mother had met and talked to her a couple of times. On this particular day she was excited because her dad was coming home from a business trip to Bali. This little girl was so happy because he was bringing her back a toy. The next day were the Bali bombings which killed her father. She was distraught and spent the next 4 days just crying with little bits of sleep in between. Her mother spent most of that time with her daughter. About 2 months later the mother passed away in a car accident while driving to the hospital to visit her daughter. So her grandparents got the duty of care for her, but she passed away 2 weeks later from the cancer. The poor girl suffered worse than I could think in her last 2.5 months of life, losing most of what was important to her before dying herself. I hope no one goes through anything like that again. My mother thinks she just gave up after her mother passed. This little girl lost everything just by some form of shit luck. My mother does leave flowers on her and her parents' grave every year on the anniversary of her death. Sometimes I really do not understand how my mother deals with being in ER. She is quite possibly the strongest person I know just because of that. Edit some words in an extra sentence. 19-year-old who was 38 weeks pregnant stabbed 9 times in the chest. Emergency C-section was done in the trauma bay. The doctors were losing their shit. There was blood everywhere. Everyone was losing their shit. Mom died a few days later and I am not sure if the baby made it. Last I heard about it the baby was in NICU having frequent seizures. I was a patient in a hospital for a heart issue when I was 22. They kept me for 3 days in the cardiac ward and I shared a room with an older gentleman who I believe was around 80 to 85 based off his visitors. I never saw him behind the privacy curtain. I was completely okay and sitting up in bed working on schoolwork most of my visit. When his family came in I could tell the situation was bad. His whole extended family came, everyone from his wife to his grandchildren. He was also on a ventilator that was keeping his breathing up. I'm not a medical person but as I understand this tube is down/in your throat. On the same night after they all visited he tried to pull everything off and it set off an alarm and a nurse rushed in. All I could hear from a very muffled voice as the nurse tried to tell him he needed this equipment to live was, "What kind of life is this?" It made me question my own issues and cry in the dark next to him. Patient got in a bad car accident. She ended up with brain damage. Her 2-year-old child ended up passing away. Every day she would wake up and not remember the accident. All day she would ask to see her child, and walk down to the gift shop to buy toys for them. Her husband would have to go back and return the toys later. Some days he wouldn't tell her about the accident because it was just too much going through the grief and the crying over and over. This breaks my heart. I can't even imagine the pain. That husband is a true hero in those moments. Damn. Got sent to the pediatric ICU to watch over a 16-year-old who tried to shoot himself in the head in a failed suicide attempt. He broke the bones that hold his eyes in and lost all function of his eyes, for obvious reasons, and also shattered the part of the skull holding the brain out of his upper sinus. He was very confused and obviously terrified. He had just learned he was going to be blind for the rest of his life and need a new skull fragment put in to keep his brain in place. On top of all of this, his divorced parents were fighting. The dad blamed the mom because he used her gun. The mom then refused to let the dad visit by not giving him the special code you need to get on unit. It was the single most ducked up night I've worked, and I refused to go to that unit ever again. I was a nursing student in ICU. An older guy had been beaten and raped so badly that the doctor's official diagnosis was abdominal catastrophe. It was the first time I understood how someone could be devastated at the prospect of recovery. The look in his eyes when he found out he would have to live with severe permanent complications stayed with me for years. I remember thinking all the trauma therapy in the world wouldn't be enough to help him. Abdominal catastrophe? What's that mean? Saw a couple lose their baby very suddenly one day before the due date. Saw a man get all of his affairs together and quit his job with a rare terminal illness. Then live. Second bit reminds me of Breaking Bad, where Walt reminisces on the day he should have died. While a student, family was hit by an 18-wheeler. Both children and wife were killed instantly. The husband wakes up 2 weeks later. And first thing he asked is about his family. Watching them break the news to this poor guy. Oh Jesus! How did he react? Like anyone who is terrified and gets the worst ducking news of their life. He had to do rehab by himself, had fam come visit. But you could see this dude was broken and done. I worked in the X-ray department. So we were doing X-rays on him once every few days. He got pretty mangled in the accident itself. Doctor here. Saw a previously very well old lad in A&D who had fallen in his small bathroom and become trapped between the toilet and wall with his knees flexed. His thighs were pressed against the edge of the bowl and his feet were squeezed up behind him. Paramedics found him after about 48 hours in that position. He came to hospital with 2 completely black legs, rhabdomyolysis, muscle breakdown, and renal failure. Vascular surgery wouldn't amputate, E2 wouldn't take him, and he died about 2 hours later. A guy got in a car accident and broke his back and was told that he'd never walk again. When they tried doing therapy, he started wiggling his toe, so some hope came back into the picture. The transport dropped him when transferring him from the bed to the stretcher and broke his back all over again. That was 20 years ago now, and he has never moved a toe again. Don't forget to lock the bed or brace the stretcher, kids. Edit. Bonus points. I also forgot about the little boy whose brother jumped off the top of the bunk bed to help him do the splits. Screams I will never forget. ICU, lady who was roughly 40, paralyzed from the chest down due to car accident years prior, currently on a ventilator through a trot and had a permanent feeding tube inserted in her stomach. When I saw her, she had a bleed in her stomach that was seeping out through the tube, and she kept pulling out her trot in an effort to end it all. They ended up having to sedate her pretty heavily to keep her from repeatedly pulling the tube out. Seeing her pulling the tube loose, and watching her actively begin to suffocate with a totally blank look in her eyes was chilling. I cleaned the rooms of the ER in my local hospital as a summer job. This woman in her 40s was dying from cancer, and she had a room in the ER for a couple days to wait for another room in another service. She looked fine for someone who was dying. I mean, she was bald and looked ill, but she was nice and lovely to be around, cheerful, etc. One time I was cleaning the corridor when I heard cries from her room. I opened the door and there she was on the floor. She fell from her bed after trying to walk to the bathroom. I helped her to the bathroom as she was crying, in pain and in fear, because she realized she could not walk anymore and that her end was coming. She broke my heart. It was the first I realized where I was really working. I had a 94-year-old woman who had been beaten by her niece so horribly that she was intubated and in the ICU. This woman was in pure agony and her family wanted to do everything for her. Come to find out, they were keeping her alive and collecting her social security check. While cleaning her up, she grabs my arm and holds it tight. Huge tears well up in her eyes. She looks at me and mouths over the ET tube, "I want to die, please let me die." That night I sobbed the entire way home. Edit. Wow, I did not expect this receive so much attention. Unfortunately, I don't know what happened to this woman. This was one of my last days in the ICU. I was a young nurse and emotionally I could not handle working there, and this was the last straw. I had nightmares about being at work and trying to take care of patients. I would wake up and see my husband laying next to me, and it took me a minute to realize he was snoring and not a patient who was on a ventilator. It sounds silly, but it's horrifying if you actually think you're in that situation. I wish as nurses we were able to talk about what we experience on a daily basis, but because of HIPAA we aren't allowed. Years later I am now an ER nurse and I love it. I see awful things quite often, but I have a better way of coping with those experiences. Mother backed out of her driveway and didn't notice her toddler had crawled into the culvert under the road. The culvert collapsed and crushed her daughter. We tried to keep the daughter alive while the mother was hysterical and the father was in shock. That was the worst. I've seen worse graphically but not emotionally. I was doing a clinical rotation in the ER. The ambulance called and said they were about 10 minutes out with a 19-year-old male with a close-range gunshot wound to his upper left chest area, think, the front of your shoulder, just below the collarbone. He came home early and some guys were robbing his house, so they shot him and took off. His parents had to wait in the lobby for the police to finish up with him before they could see him. The angry look on his father's face and the wailing sound that his mother was making are not things I will soon forget. Kid made a full recovery, BTW. He's got a small scar and story to tell. I have seen many people die, but the worst one by far was a man with active bleeding, hemorrhaging from his esophagus due to long-term alcoholism. This was many years ago and there are better ways to treat it now, but at the time the treatment for this kind of hemorrhaging was putting an inflatable tube down the throat into the stomach. It was attached to some kind of helmet that you had to put on the patient afterwards, which was tough. You would inflate the tube to stop the bleeding but also aspirate the blood out of the stomach with a huge syringe. Just putting it in was horrible. The patient was so scared, there was blood everywhere, he was vomiting blood, shitting blood, he couldn't hardly talk due to the bleeding. This was in the ER. We got IVs in him, started transfusions pouring into him as fast as they'd go. We worked on him for a long time but he didn't make it. What I remember is how hard he fought, how scared he was and how much blood there was. And this was before rubber gloves were worn for everything. I just threw out my uniform. Everyone's shoes were soaked. I never saw anything like it, before or since. Don't become an alcoholic. Don't get cirrhosis or esophageal varices. It's a bad way to go. Not exactly something I saw the patient go through, but I saw the sweetest old lady who was suffering with chronic kidney problems because, when she was younger, she worked as a maid for some evil twisted people who forbade her from using the toilet at work, 9 to 5 not including travel. So she had to force herself to hold a full bladder daily for hours at a time. This is a great way to get stones, which in turn can cause obstruction and damage the kidneys. She was so sweet and lovely, and it just really got to me that people could be so needlessly maleficent. I volunteered in a children's hospital throughout high school. There was a 16-year-old patient there who had spina bifida and had no feeling beneath the waist. He had routine surgery, and expected to be in the hospital for about a week. The worst thing I've ever seen was the look on his face when he told me that the doctors had found MRSA on both of his legs, and he wouldn't be leaving the hospital anytime soon. Hospital trips are kind of funny. The first week everybody wants to visit you, but after that guests seem to taper off dramatically. I remember him stating that the hardest thing for him was the lack of social support beyond his family, and to a much lesser extent myself, as this was like the year before Facebook really being a thing that everybody had. Happy ending though, he eventually did recover from MRSA after spending around 6 months in the hospital. Watching a new mother bleed out while her mother held her dead newborn grandchild. Duck me, that still screws with me. I worked at the hospital in high school. I delivered food trays to hospital rooms, so it was a very easy job. We were encouraged to have brief conversations with the patients to try and cheer them up a bit. The hardest one to deal with was our high school principal. Our principal dealt with 2,700 students but was beloved by all. Not often you find a person like that. Well, one day she got real sick and had to go to the hospital. I walked into her room and saw her in there. Somehow she remembered my name after I had only met her maybe twice. I saw her every day I worked and saw her degrading for months. All during this time people in school had their rumors that she was getting better. Somebody's mom saw her shopping, people heard she was coming back next week, etc. I couldn't say anything obviously. But it was very hard to deal with watching so many people have hope in me knowing that this truly wasn't looking good. She died about 3 months into being in the hospital. The school was devastated. Worked in an orthopedic clinic and we had a woman come in to have her shoulder replaced. She was pregnant. A man broke into her house with a shotgun, killed her husband, shot her in the shoulder, and then killed himself. I don't know the reason. All I know is that she was now a future single mother with a dominant arm that was basically non-functional. That's devastating. This whole ducking thread is devastating. Basically, anytime a patient, especially elderly, is hanging on with every possible form of life support, vent, dialysis, repetitive coding, and the family refuses to make them a DNR. I know it is a hard decision to make. I know you don't want to see them die. You also don't want to be in the room when they code. You don't want to be in the room the third time they code, wondering if we will be able to bring your loved one back again, just to see his chest rise and fall mechanically. To see him being turned every hour and leaving the room so that your modest dad can have some privacy while we clean him up because he can't control his bowels. Please think about what the person would have wanted. Thanks for listening to another episode of Reddit X. Subscribe and activate the notification bell so you won't miss any stories. Feel free to share your own stories below in the comments. Have a good day.